That means that no matter how we reform health care, we will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what. My view is that health care reform should be guided by a simple principle: fix what's broken and build on what works.
Okay.
And that's what...
Bishop, do you think, in light of what HHS has ruled, do you think the President's kept his word?
I think right from the beginning, we bishops have been very concerned that conscience protection be built into any form of health care reform that would emerge.
And because it isn't, there's no way that statement that the President made can actually be true.
We feel that...
as it applies to you.
We feel that we have good relationships and we've exercised our freedoms wisely, and therefore it's not been broken and shouldn't be fixed in the way it's so-called fixed.
Reverend, did the President
as a church body, we have no official position on the rightness or wrongness of the President's health plan.
The President said if you like your plan, you can keep it. Is that true?
All I would like to say is that we are here, I am here today because we are deeply concerned about the religious liberties provision.
Will you be able to keep the same plan? Just rules in place?
We're hanging on by a fingernail, and as I said in my opening statement, I believe a couple of strikes of a keyboard could eliminate our freedoms very easily.
Doctor, did the President honor his promise?
I think it's very ironic that he used the word several times, trust, and predicated his comments on the word trust. I'm not from Missouri. I've lived there before, but I'm not from Missouri. I have to say that any future rulings from the HHS, I'll have to see to believe.
Yeah. Will you be able to keep the plan that you offer?
Well, we have, yes.
Rabbi?
I'm not here to represent an institution that offers a plan or does not offer a plan.
Got it. Here's your,
what brings me here is great concern when an administration or HHS claims the power in a mandate to define what is a violation of religious belief and what is not a violation of religious belief.
Finally, if I could, just Dr. Mitchell, do you think the President kept his word with the clip you saw?
I don't think that he did. Okay. I think that rather than fix what's broken, he's broken what was already working.
I yield back. Thanks.
I thank the gentleman. We now go to the gentleman from Illinois, Mr. Davis, for 5 minutes.
Thank you very much, Mr. Chairman, and I want to thank all of our witnesses for being here. As I listened, this is a very serious discussion, and I think all of America is really watching and listening to what it is that we have to say. I first of all want to associate myself with the comments made by the former chairman of the full committee, Mr. Towns, and my colleague from Illinois, Mr. Quigley, relative to the absence of women on this particular panel. With that said, it seems to me that we have not talked a great deal about the health care benefits of the discussion, of the issue. And given the fact that the discussion emanated from implementation of provisions of the Affordable Care Act, let me ask if either one of you gentlemen have a health background in terms of any kind of health delivery to individuals? No? All right, let me just, obviously, there are many well-known benefits for women to be able to control their own lives and to plan their pregnancies, including by using contraception to determine whether or when they get pregnant. But that's merely the contraceptive use. A significant proportion of women, 1.5 million, use the pill exclusively for medical purposes other than contraception. They use contraceptives to treat severe menstrual pain, migraines, uterine fibroids, and endometriosis. Oral contraceptives also help prevent ovarian cancer. One study found that oral contraceptives have prevented 200,000 ovarian cancers and 100,000 deaths from the disease. Is it your understanding that, or do your religious teachings prohibit the use of contraception for health-related purposes, such as treating ovarian cancer? Bishop, perhaps we could start with you.
I think Catholic moral theology is very nuanced. It recognizes that the same drug can operate in different ways and accomplish different things. If it is used to prevent birth, it is against our teaching. And so we have operated with with a lot more nuance than we're usually given credit for. Also observe, by the way, that 90% of all private health care plans give access to contraception. We're talking about a very narrow band and for very specific purposes here.
Yes. Anyone else?
We're all for medicine for women. In fact, I've spent years of my life working with relief and development and charitable organizations providing specifically services to women. So we're all for medications that help women. We're just not for using certain medications to end pregnancies.
I think that
I was just going to add, in our setting, because we are a free church, the use of contraception, the contraceptive pill, for instance, is a matter of Christian liberty. So that is, the use of the pill is a matter of Christian liberty.
I think that there are perhaps some people who get a bit confused when they try and sort out what the most rational, logical approach might be, especially if we're trying to improve health care and if we're trying to provide the best health care delivery system. And so we see numerous health experts who recommend the use of family planning as part of preventive care for women. The American College of Gynecologists, the American Academy of Family Physicians, the American Academy of Pediatrics.
I'd ask the gentleman to have an additional 15 seconds.
And the American Public Health Association. So my 15-second question is, if a woman who worked for one of the institutions that you might be associated with had need for these services as a health measure, what would your position be? Should she receive them? Should she get them?
You could answer briefly. Anyone who wants to answer could answer briefly. Time's expired.
Congressman, if you as a legislator or the Administration of Health and Human Services sought to provide greater preventive care, seeking in an initiative to prevent illnesses among women or men, and that was the focus, none of us would be here today. We're not here because we wish to in any way hurt preventive care of anybody. And you absolutely could have done that, and the administration could have done that. We're here today because the administration is showing insensitivity to the liberties of conscience of some faith communities in America. Not necessarily in this case, my faith community, but that's the insensitivity being shown here. And that's why we're all here today.
Thank you very much, and thank you.
Thank you. And with that, we go to the gentleman from Pennsylvania, Mr. Kelly, for 5 minutes.
I thank you, Chairman, and I would like to just yield 15 seconds or so to Ms. Burkle. I thank the gentleman from Pennsylvania. Just briefly, because it was just raised, the issue of access to health care. On Monday of this past week, I toured a very prominent, wonderful Catholic hospital in my district and talked with the administrator, and they are a self-insured program. And she said to me, if this rule continues to be enforced, we will have to drop our self-insured. All of our employees will have to go into contract with an insurance company, and it will dramatically raise their costs. So I think that's one of the unintended consequences of this rule. I yield back, and I thank you.
All right. I thank you, Lee. And all of you, thanks for being here today, because this is a difficult situation for a lot of people across the country. And I think it was Dr. Mitchell that talked about trust and truth. And I have a habit every time I'm in these meetings anymore is going to get some definitions of what truth and trust are. Truth is nothing more than sincerity in action, character, and utterance. Trust has to do with assured reliance on the character, ability, strength, or truth of someone or something. And this hearing today is about freedom of speech, freedom of religion, and a government that continues to intrude on our private lives in ways that we may not agree with, and certainly don't agree with in many, many ways, shapes, and forms. In another, the area of the country where I'm from, there's an old saying that goes something like this: fool me once, shame on you; fool me twice, no, shame on me. And I think we've reached that point in the most transparent administration that we've ever seen. There's one thing that is very clear to me. Transparency has nothing to do with any of this. We take bad policies, and when we can't shove it down the public's throat, we take the package back, rewrap it in a little different color paper, put a little different bow on it, and say, do you like me better now? So I have a very difficult time sitting here in these hearings and getting beyond what it is we're talking about. We are talking about the Constitution. And we're talking about a president whose former job, at the University of Chicago, he was a professor of constitutional law. So I find it difficult to understand how the Constitution only has relevance in certain days and in certain times, and only if it really appeals to something I'm trying to push that day. So we've come to constitutional niceties and constitutional convenience, and what we have done, we have turned our back on freedom of religion, freedom of speech, and again, a government that's too overbearing. So, in light of all that, and Excellency, we could start with you, any of you. Because of the transparency, let me ask you, did anybody in the White House or Secretary Sebelius or anybody from the Department of Health and Human Services ever seek your input in any of this language? Excellency.
Not on this latest round of rules, no.
Okay. Previously?
We certainly had the opportunity to comment when the interim final rule by HHS came out in August of 2011. We had the opportunity to comment. Massive numbers of comments were sent in. As is well known, the President met with Cardinal Designate Dolan, and so there was certainly a meeting at that level. But then, before the final rule came out last Friday, there was no prior consultation.
Would the gentleman yield?
Yes, I will.
But on the earlier promotion of what now is known often as Obamacare, you were well consulted. There was an outreach to get support for that, wasn't there?
When the underlying bill itself was being debated, we certainly had the opportunity to weigh in, and we did.
I thank the gentleman.
Okay. Any other members of the panel? I mean, I really am concerned because we talk all the time about this transparency.